So today we're going to do a cheek augmentation. Cheek augmentation is one of the procedures that probably terrifies women most when they think about non-surgical procedures, purely because you see so many celebrities who've got overfilled cheeks, which makes the face look unnatural and disproportionate. The way that I try and explain it to patients is that what we're doing with cheek filler is not trying to change your face, we're trying to restore it. And so long as you keep within the confines of restoration and maintenance and not trying to change the face, it will look nice and natural. The reason that we augment the cheeks is that as we get older we lose fat from the face, and as we lose fat we get a sunken hollowness in the middle of the cheek, and that allows the other soft tissues to descend. And when we restore that little bit of volume loss, it helps to improve the contour of the mid face, and it also helps to give the cheek a little bit of a lift. And actually done well, it is one of the most gratifying procedures that we can do in non-surgical practice. Our understanding of the anatomy of how the face changes with age is advanced considerably. We now have a much deeper understanding of why the face ages and what's going on at an anatomical level. Before, we used to think of fat underneath the skin as one big flat layer, as one big continuous layer of fat, but now we actually know that it's divided into individual compartments, and each compartment is defined by its own little membrane that surrounds it. And all of these compartments age in different ways. So we've got much more specific and targeted ways of being able to approach the cheek, and actually by having that much more anatomical and targeted approach, we can keep things looking much more natural, because what we're doing is emulating nature. We're not doing something that never existed in nature. Now, Bernadette's already had a cheek filler before, so the degree of hollowness that she has in her mid-face is still not too bad, but you can see that there is this impression of a bit of hollowness right in here in the middle of the face, and this corresponds with a fat pad that lives beneath the surface of the skin called the deep medial fat compartment, and it's this area that we're really trying to augment with the filler. I'm going to do a little bit of lateral filler just over here to give her a little bit more projection to the cheekbone, and I'm also, when I'm inserting the filler under here, I'm going to inject that underneath a muscle called zygomaticus major. The zygomaticus major muscle comes up here from the corner of the mouth up to the cheekbone, and it has the purpose of lifting the corner of the mouth at the same time. I'm going to begin just by injecting a little bit of local anaesthetic to numb the surface of the skin where the cannula is going to go through. For injecting the cheeks, I always use a blunt tipped cannula, purely because I want the filler in a deep subcutaneous level, and there is no advantage of injecting it there with a needle. And the advantage of using the cannula is that it's much less likely to damage important structures such as blood vessels or nerves, so we get much less bruising and swelling after using the cannula in this region. Okay, so this is the only part of the procedure where there's going to be any discomfort, just as I inject this little bit of local anaesthetic. The filler that I'm going to use today in the cheeks is something called Juvederm Voluma. It is specifically designed for lifting cheeks, jawlines and chins. It's a really nice long-lasting filler that will give us augmentation here for at least 12 to 18 months, and quite often longer than that. The cannula has a blunt tip, so we want something that really is genuinely blunt, so that when it's passing through the tissue, anything of importance like a blood vessel or a nerve just getting pushed out the way rather than cut through. Because the cannula is blunt tipped, we can't just pierce it through the skin, so we have to begin by making a little incision just using a traditional needle, and that just goes immediately through the surface of the skin, creates a little entry port, then through that little entry port I can pass the cannula. Now, the areas where Bernadette has lost most volume corresponds to something called the deep medial fat compartment. Previously, I would have inserted the cannula from over here and tried to get down into the mid-face, but actually, as our understanding of the anatomy has become much more sophisticated, it's much more reliable and easier to access the deep medial fat coming in through the nasolabial fold. When I get that tip of the cannula into that exact pocket, I can just feel with my fingertips that I'm in the right plane. So I'm just coming up to the top of that compartment as well, and by filling up there, it also helps to soften the junction between the lid and the cheek. And then I'm going to come back in over here, and I'm going to come in underneath the zygomaticus major muscle. And typically when I start filling in here, there's a little bit of discomfort. Does that feel a little bit nippier?
Slightly.
Okay. And the reason that that's quite often when I'm doing this, patients will say, oh, it's a bit nippy over here. It's because it's stretching the muscle fibres, but that's nice to help us lift the corner of the mouth. And again, I've got myself into that potential space in the deep medial fat compartment. And I'm just going to slowly start filling that out. How does that feel?
Fine.
And again, doing a little bit of augmentation up here towards the top of the cheek, which again helps to blend the junction between the lid and the cheek to give us a little bit more lift to the corner of the mouth. You just never get any lumps or bumps doing this. I just don't see people with lumpy, bumpy fillers. It just doesn't happen. So we really don't need to do very much in the way of massage. And yeah, immediately afterwards, we've got virtually no bruising or swelling. A couple of tiny little needle marks that Bernadette can put some makeup over and we'll cover up in a couple of minutes. And other than that, she can go back to work immediately and do whatever she wants. Okay?
Yep, looks fantastic.
Okay, so it's nice and symmetrical. So it's a nice rejuvenation to the midface. It's taking away some of the hollowness and droopiness, but without giving any of the sort of exaggerated stuck-on cheekbone look that so many women are scared of. As long as we have a nice anatomically precise injection, that unnatural look just does not happen.